Hi, my name's Amanda Wood. I'm the Principal Psychologist at Real Therapy Solutions. We're getting a lot of questions lately about the new guidelines or how to get a diagnosis of autism if you suspect your child or even an adult has autism. Look, one thing to know is the rules around who can diagnose, who's qualified to diagnose autism, have not really changed. But what has changed is the best practice guidelines, or the criteria that a lot of funding bodies like the NDIS, like Centrelink, will accept a diagnosis from. So that's what's changed. And I guess the best practice guidelines are saying that for a child, the diagnosis needs to come from a paediatrician, a clinical psychologist, or a multidisciplinary allied health team. And I guess for an adult, they're saying a clinical psychologist or a psychiatrist, and an allied health team, which is probably less likely with an adult. Look, what does this mean if you're needing to get support around a possible diagnosis and looking for somewhere to go? I think it's really important to get a diagnosis from someone who understands autism. I can talk for psychologists and other allied health professionals in that we don't get a lot of training in diagnosing autism at university. So all of those skills and understanding about autism come usually from what work we've done outside of university. So you may have one of those professionals that's on that list that has barely met a person with autism or only diagnosed 2 people. You may have someone who's not on that best practice list, like myself, who's a psychologist with a master's degree, but not in clinical psychology, who has diagnosed over 100 people and supported over, I would probably say about 500 people with autism. So what does that mean? I think the best practice guidelines are really important though, because we do need people that understand autism to diagnose it and support people with autism. And this is one of the best ways of looking at that. But I think as a family, as someone who is supporting someone with autism, what are you looking for? Ask whoever you go to, make sure that it's, if you're looking for getting an NDIS funding or Centrelink funding, it's got to be a paediatrician, a clinical psychologist, or a multidisciplinary team. So you're going to have to go to one of those. You can ask, what experience do you have in diagnosing autism? And I guess the other big factor that's going to come into play is, being realistic about it, is cost. To see an allied health team can be quite expensive. A paediatrician could diagnose with one session, but is possibly unlikely to, as is really a clinical psychologist or any other psychologist. So you're looking at multiple sessions to get a diagnosis. One of the most cost-effective ways would be to see a paediatrician, to get a referral to a psychologist that has experience in autism, and it doesn't need to be a clinical psychologist. And then using that Medicare referral, which will give you a rebate, see that psychologist and then go back to the paediatrician to have it signed off by the paediatrician. So that is probably going to be your most cost-effective way. You could do a multidisciplinary team, and your paediatrician may diagnose without having to refer elsewhere. I know it can be really confusing, and it's the last thing you need when you're going through a diagnosis for autism for someone that you care about. But I guess the most important things is find somebody who understands autism, whatever the discipline is, whose diagnosis is accepted for those funding bodies. You don't want to have to go back and be re-diagnosed or go back to another professional after you've gone through the whole assessment. So I hope that's helpful. Real Therapy Solutions, by the way, we are able to diagnose. We are a multidisciplinary team. We work with a number of paediatricians, and we can diagnose adults with autism as well, but you will need to go back and get it signed by a psychiatrist. So you may be better off going initially to a psychiatrist for a diagnosis if you're an adult. All right, thanks very much.